FORA.tv. The world is thinking.
All right, well, let me go back to my scenario. So we've told this man, go ahead and get your grandmother a $45,000 hip. It turns out she dies a couple of weeks later. It also turns out that this man was Barack Obama, because this actually happened. Art, did he make the right decision?
I'm not sure, because I know Barack Obama said, I would pay for this out of my own pocket, but I'm not sure whether he knew whether it would work or not. My partner Ira says, you can keep people going and really extend their lives in useful and important ways by giving them that hip. They're going to be able to have a good quality of life, get around. But I would argue that we aren't doing everything. When we give that hip in Medicare, you can see the Medicaid program shrink. You can see the uninsured child population grow. We keep making decisions that shift resources toward those who vote and who have constituencies that speak up. Anybody who looks at how we're doing with mental health today would know that we've made some very interesting choices about pouring money into dying and leaving those who are afflicted and demented on the streets. But let me add one twist to your case. What if she has advanced Alzheimer's? So she needs the hip, but now where are we? I think I might engage in a discussion if I was doing the ethics consult that said, look, your mom is, even if we give her the hip, I'm not sure she's going to be able to function well with it. I think Ira's scenario will change. Did she say anything about, was there a time at which she would want to forego anything or not have this kind of operation done if she couldn't enjoy her life, communicate with others? And I think that some would answer that yes. And I don't consider that immoral or unethical. What I think it is, and I tell Barack Obama this too, is be informed by data. Don't worry about the bureaucrats in Washington. Let's really pull apart. What does it mean to get an 86-year-old with a hip replacement who's severely demented? What's their future going to hold?
All right, so now I bring on you, Ken Connor, as the ethics consultant in this case. What do you say?
Look, my professional life is spent representing victims of abuse and neglect in nursing homes. And I can tell you that America's dirty secret is the way it takes care or doesn't take care of the elderly in nursing homes. And the demented and those who suffer from Alzheimer's are treated as second-class citizens. I don't believe there's a sliding scale of dignity. I don't believe simply because your faculties decline that somehow you should be relegated to the back of the bus. That's wrong. I also think the basic flaw, frankly, in the proposition that you're advancing, Susan, is that either we ration or we go bankrupt. Those are the only two alternatives that are being advanced. I don't think those are the only two alternatives. We can allocate more resources to health care. For heaven's sakes, we spent tens of billions of dollars on aging sclerotic car companies who had lost their competitive edge and infused them with billions in an attempt to resuscitate them. We spent billions more for cash for clunkers, for heaven's sake.
Their health care costs.
What you're saying
That's what
is,
killed them.
Art, what you're saying is that if you're a human being who's a clunker, you're out of luck.
I'd say if you're a human being who doesn't see a future with an artificial hip, if I'm demented, make room for that person to forgo those resources.
Well, here's a news flash. My experience has been that the perceptions that people have about the quality of life of the frail and the elderly and the vulnerable and the handicapped aren't necessarily shared by those people who
I'll let you talk to them before they make the decision.
Let's turn this back to somebody who lives this.
I really agree with you in many regards. That lady should get her hip, but she doesn't necessarily need a titanium hip that's designed to last 50 years. Maybe a stainless steel hip that's designed to last 15 years is good enough. But there's another stakeholder here, and that's industry. Industry keeps pushing on doctors the latest and greatest, the implantable cardiac defibrillators that can cost up to $90,000 per person. If this woman with terminal cancer has an arrhythmia, should she have a implantable defibrillator? Should she have the titanium hip? These are decisions that doctors don't want to make without a societal framework. And that societal framework, as you rightly said, and you know it from your work, disadvantages those in nursing homes. The staffing level in nursing homes is a national disgrace. Sometimes 15 people who need help in eating for one aide. There are people starving in nursing homes, not because they can't eat or don't want to eat, but because they need help in eating. So the way we staff nursing homes, the way we underpay the aides and nurses who work there, who are heroes in America today, is a national disgrace. And on just paying for anything that a patient wants at the end of life, there is the consequence that some people don't get into the life raft.
Well, I don't disagree at all with that, but again, you're much quicker than I to try to take the doctor out of the loop.
I don't want them out of the loop. I just want a societal
your
framework.
decision-making dictated by someone remotely. And what I'm saying is the American people want the informed decision recommendations of their doctors, and that the people
Absolutely.
and the patients and their families, along with the physicians, ought to be the ones making that decision. We don't want somebody 1,000 miles away saying, sorry, 89 years old, demented, end of story, no further discussion.